Okay, here we go. Ding, 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 and a one, a two, a one, two.
Welcome to Stony Brook University's Beyond the Expected podcast. I'm Michael Bernstein, Interim President of Stony Brook, and your host of today's discussion, featuring three members of the university community who are professionally and personally affected by the coronavirus event. Stacey Finkelstein, you are joining us remotely, self-quarantined in the New York State designated COVID-19 containment zone in New Rochelle. We'll ask you how that's going, and we'll also get some insights from you on the coronavirus effect on the state of our economy and its impact on consumer spending. Stacey is a member of our faculty in the College of Business. Dr. Sharon Nachman, you're here with us in the studio. You're one of our first guests on Beyond the Expected during the early days of the 2019 coronavirus event. You were sharing your expertise then on the curious manifestation of this influenza-like illness. Things have certainly changed since we last spoke, and thank you for being here, and you will enlighten us further today. And finally, Professor Nancy Toms of the Department of History, a friend and colleague in that department with me. You're here today to share your insights and expertise on the history of pandemics and the history of American healthcare. Your 30,000-foot view, or shall we say 30,000-year view of pandemics, should shed some light on the current issues and what we can expect over the next 3 to 6 months. We'll also delve into your perspective on what's going on globally and locally and how the coronavirus has been preceded by other historic events like the HIV, AIDS, and Spanish flu epidemics. Thank you for being here as well, Nancy. So let's begin, and we'll start with Dr. Nachman. We understand there are patients at Stony Brook University Hospital that are being treated, so we know the coronavirus is now here in our community. What do we need to know right now from a clinical care and public health perspective in your mind?
I guess the first and most important thing is don't panic. I think the current feeling out there on the street, in the neighborhood, in supermarkets is everybody running around and panicking. The answer is, for the most part, more than 80% of the patients who will get this infection will be totally well. They will not require emergency room care, nor hospitalization, nor ICU care. So yes, we expect that pretty much everyone will get it, but the vast majority of people who will get it will do completely well. That 20% who in fact will wind up in the hospital and a very small percentage who will wind up in the ICU are the ones that we are seeing now at Stony Brook. As you know, Stony Brook, as well as the VA Center, the VA nursing home, in fact, have instituted strict visitor policies. We don't want you coming into the hospital. If you are seeing anyone, we don't want any visitors. And recognizing that I'm a pediatrician, that's really hard for children. So we are, in fact, allowing only one parent visitor for each child. With regard to labor and delivery and postpartum, each pregnant mom, delivering mom, is only allowed the same one person the entire time they're here. So yes, if you come to the hospital expecting to see someone, visiting them, you're unfortunately not going to be allowed in. FaceTime really works, Skype really works, and we are encouraging everyone to use those.
So we're greatly restricting visitors to the hospital. There are no visitors allowed right now in the State Veterans Home across the road from the hospital. We made that announcement too.
That's
we're
correct.
Restricting access except under exceptional circumstances.
Correct.
So let me ask, what about all of you, the healthcare teams that are at the front line of this epidemic? What about protecting yourselves while you're caring for our patients? How do you deal with that? It must be a very stressful time.
It's certainly stressful, not just for the physicians, but for the entire staff, from nursing, respiratory, to even housekeeping. We're going into rooms that we know or think patients may have true infection or possible infection. We are wearing appropriate protective gear, and most importantly, just like you're doing at home, we want everyone to keep washing their hands. Washing your hands before you go in a room, after you come out of the room, and before the next patient, all over again.
And of course, if you're feeling ill in any way, shape, or form, take steps.
Please don't come to work.
Right. Quarantine, get in touch with your healthcare providers, and find out what's going on.
Right. As you know, the hospital has instituted a lot of policies about how we want our patients to come to us. We don't want them just showing up in the emergency room and saying, I have a friend who is sick, I want to be screened. We're still limited on who we can screen, and over the next few days to weeks, we're going to be rapidly changing policy, perhaps often, to say we can't screen, to who we can screen, to where we're going to screen them.
Okay, that's good to know. So obviously, all of us being directly affected by this in many ways, shapes, and forms. Let's bring in Stacey on the phone with us. You're sequestered in New Rochelle, where the National Guard's been deployed. How are you doing up there? Tell us what's going on.
Well, thank you, President Bernstein. Things are relatively quiet here in New Rochelle. I know that depending on which news source you're getting your information from, things can sound quite scary here in New Rochelle. We are a quote-unquote hotspot of activities, as there are many cases that have been diagnosed in my community relative to the rest of the state so far. The National Guard is here, but they're here purely in a peacekeeping capacity to deliver food to residents who are quarantined, who are self-quarantined, or to children who are not able to go to school, who might rely on school lunch programs and the like, school food programs rather, so that they can be fed and have some access to food that they might otherwise not have access to in their homes. So it's very quiet up here. The grocery stores actually do have quite a lot of stock, and I think that's because people are avoiding leaving the house, even if they're not in the containment zone. But the messaging that we're receiving is that anyone who's healthy, is free to move about in the ways that they would during their normal life. So the community is holding its breath at this point, and things are fairly quiet.
Thanks, Stacey. So, Nancy, what about you? I mean, from the perspective of an active scholar teacher on our campus, how are you and your students and peers being impacted? We've made the decision to pursue non-traditional learning, distance and remote learning. Tell me how that's going for you.
So far, so good. I think the students understand that decision was made for their own safety. And they're trying to get into the spirit of it as best they can, as are the faculty. So I myself am trying to see it as an opportunity to take the time to go and learn some of those online skills that I never found time to
We're all learning very quickly.
Yes.
Lots of things.
But I also see they have a lot of skill sets to draw on in their own experience that they're more comfortable with connecting virtually, I think, than some of them.
There's a great point. They can be our partners here in an important way. So let's talk about some broader impacts. There have been obviously massive cancellations of events spanning from athletics to artistic gatherings to exhibitions. Obviously, we're going online with respect to so-called FaceTime teaching. Gatherings of 500 people or more are now being prohibited in the state of New York. Restaurant patronage is down 50%. I understand it already. So I guess I'm interested in hearing, first of all, from you, Dr. Nachman. Do you think this will slow down the factors surrounding this incident?
So the reason that all of these events have been canceled and we recommended only small groups meet is not that we think that we're going to prevent everyone's infection. We assume that people will get infected. But what we're doing is called flattening the curve. We want, instead of 100 people getting infected on Monday and 100 on Tuesday, we want those 200 people to be infected over a longer period of time. Because in fact, that translates into less people coming into the hospital or the medical care system at any given day and allows our resources to be used more wisely. We don't think it's going to prevent everyone's infection, but if we prevent infections happening at the same time and rather allowing them to happen over time, health resources will be used much better.
Much more effectively. So, Stacey, let's bring you in from the economic perspective. You're our business and economic specialist here in the podcast. Shelves are empty in many stores, apparently not in New Rochelle, but certainly around here in Stony Brook, paper products, disinfectant products, hard to come by. And then there's the psychological impacts of all of this. So what's your read from an economic perspective of these early impacts of the epidemic?
Yeah, my read is that, of course, people are engaging in panic buying, and there are any number of reasons why people might be experiencing fear and uncertainty. I know that with the stock market being as volatile as it has been and decreasing the way that it has been over the last week, that could be a cause of uncertainty for a lot of people who are nearing retirement or had thought to retire in the next few years. But also, with media coverage and the way that some things have been described, it's very easy to be fearful of this situation, if you're constantly bombarded with negative information in the news. So, we are seeing people engaging in panic buying, and one reason could be that, the act of stocking up on toilet paper and sanitizer is a means of comfort or to exert control in a very fearful or uncertain time. So the needs that people might have for control in their lives might lead them to, think of ways that they can buy material goods to protect themselves and control at least some aspect of their lives.
Really?
But it could also be that people are very bad at assessing individual versus community risk. And so, what consumers might not be thinking about is that by hoarding masks and hand sanitizer and all of these other goods that medical professionals need, they might actually increase the community risk if people who are vulnerable or people who are on the front lines don't have access to the products that they need in order to help contain the spread of the virus.
That's a really interesting point, Stacey. Let me just turn to Nancy here and ask about, historically, how does this compare the Spanish flu, et cetera?
One of the biggest differences that I see is the degree of fictional and imaginary scripts that Americans have to run of the face of a deadly pandemic that did not exist in 1918, 1919. Sure, people may have had some knowledge of the Black Death and the loss of life, but the kind of fictional, the terrible germ that comes out of nowhere, that's a trope that is of relatively recent origin. And we can date it back to the 1970s, to some of Michael Crichton's early work, that I think part of what causes the panic is people are going back and watching Contagion, and I have to admit I did. They have that script in their head. Here we have a virus that I think Dr. Nachman was trying to explain to us is not Ebola type.
It's not lethal.
No, but people read it as a threat, in part because they have these scary stories.
So in relation, it's a really interesting point. So looking back in the early 20th century with Spanish flu, obviously we didn't have the telecommunications connections that we have now. So you think that's a key part of this story?
Yeah, partly, but what's interesting about the Spanish flu, is that it was the golden age of newspapers. And in fact, I would say it's the first 20th century mediated epidemic. They could see it coming at them.
So
and that
just
was
for
part
the sake of our
panic.
Listeners and viewers, just the years of the epidemic, and you just...
1918, 1919, so it started at the end of
World War I.
World War I. Mm-hmm. And they could see it because it moved with the troops and then to civilian populations. It comes to Boston, it comes to Philly. New York can see it coming. Mm-hmm. The newspapers are covering it. Seattle can see it coming. So in some ways it's similar. We saw Wuhan. Now we see Italy. We see it coming at us. The difference is 24/7 and the number of competitive media outlets, and also the possibility for self-news.
I guess for me, the important part is when we label something a pandemic, that doesn't mean that it is more deadly. A pandemic only describes how infectious it is. Yes. And when people hear pandemic, they think, that means it's deadly. And the answer is we've had lots of other more deadly. SARS was much more lethal. Ebola was much more lethal. They weren't pandemic. Flu is, remember H1N1, that was a pandemic. Indeed. It was not lethal as well. So people have this idea that when we label something pandemic, it is more lethal. It actually means it's more infectious.
That's a really interesting distinction. And what I'm hearing from all of you, from your different perspectives, from the historical perspective, from contemporary medical practice perspective, and Stacey with her perspective on consumer psychology, many reactions or misperceptions are creating more harm than doing good in response to this crisis.
It's also the mirror. In other words, every time you hear about it, it mirrors your worst thoughts about worse outcomes. So if you mirror the news 4 times a day, 6 times a day, you get exponentially more concerned about, should I be even more worried? Should I be more worried? And the focus 24/7, as you've mentioned, by the news also, in fact, increases everyone else's concern.
I'm wondering, again, looking historically, Nancy, is the response, well, I know two very different eras, scales are totally different, but preparation and initial response, how would you compare, the years right after World War I with the Spanish flu coming to the Western Hemisphere and this epidemic?
I've been thinking
pandemic.
a lot about that because I think the kind of consumer panic buying that Stacey was describing. I mean, back in World War I, people didn't have refrigerators. Most of them had indoor toilets, but by that time, but the kind of
Not
idea
everyone,
that
yeah.
you would go and do all this panicked buying, no. I think their sense of concern was much more going out in public, the sort of social distancing playbook that we use today was in effect. They understood that was.
But
the
also
way to slow it down.
going to Sharon's point, the exposure to news was far less frequent. It might literally be
Definitely.
once a day or once every few days, right?
A lot of people read the paper in the morning and
Right.
the
And that would-
afternoon.
right.
But another difference that I noticed when I went back and looked is although newspapers were very competitive in this time period, they were trying to steal readers from each other. They didn't use criticism of the public health department as a way to sell papers. There was, in fact, disagreement among public health leaders about how to handle the flu, but it didn't get into the newspapers. It was kept as a private kind of debate. Maybe it was because of the war. There was still that patriotic
That's
thing
interesting.
going on.
So,
Yeah.
speaking of perception, Stacey, again, just looking economically, I notice the Dow has crawled its way back to about 22,000 right now this afternoon. I just checked on my phone. It's lost a great deal of ground over the past few days. But so, from your perspective, and given people's attitude and their digestion of information, I mean. Let me put this starkly. Is there anything to look forward to with respect to the performance of our economy in the next weeks?
Well, I'm really curious to see what happens legislatively in the coming days and weeks. I think that thus far, messaging from the government has sometimes been mixed and inconsistent, and any marketing person can tell you that messaging is incredibly important in calming consumer fears and giving the perception that hope is warranted. And so I think that there are any number of, fiscal, monetary, legislative policies that we can enact, and some of them would be incredibly helpful, like family leave, giving everyone paid family leave, paid sick leave to help them transition to caring for loved ones or caring for themselves if they're infected. Ensuring that people have access to food and that food insecurity concerns might be mitigated would help in the event that schools do close for all of those students across the country who rely on schools as a key source of nutrition for them. So I think there are any number of things that we can do to calm consumer perceptions. I think one thing that isn't particularly helpful, and perhaps Nancy can speak to this too, is that I think that many people feel fearful and terrified because they feel stigmatized.
Yes.
There's the perception up here in Westchester, that I've seen comments on discussion boards with very anti-Semitic sentiments. Because the Jewish community has been impacted very, very hard up here.
Good point.
I've seen a number of international students who are concerned, because, heaven forbid that someone who's from Southeast Asia sneeze in a public place, they'll be given, they'll be met with glaring eyes. And so I think that doesn't help, to the extent
Certainly
that people experience fear and stigma.
It's also striking. I was just thinking about this, digesting some of the news this morning. Nothing's been done yet in Washington, but some of the proposals in Washington about stabilizing the economy in the face of these blows. I mean, the order of magnitude of some of these proposals is enormous, relative
Well, a payroll
to
tax is going to
2008.
do very little. A payroll tax assumes someone is still being paid.
Right, yeah. And I think your point about dealing with perception of scarcity is a very important one, too. If people can have confidence that they will have access to things they need, essential things like food, let alone medical supplies, that will make a big difference. Because as we've discussed just moments ago, some of the panic buying and hoarding and so forth is actually exacerbating the situation, making it worse. Looking to the medical response again, Sharon. So. Stony Brook Medicine obviously is at the center of this for our region, for Suffolk County. I know that people are working 24/7 literally over there at the university hospital. But what's your perception of the positioning of the hospital and the clinics? The staffing, or our healthcare providers in the community? Ready to deal with this as best we can tell.
So I think the first is that the hospital is very up to date and ready and able and willing to do exactly what it needs. There's no suggestion that, we can't handle this or we don't have enough beds. We have plenty of beds, we have enough staff, and we have enough supplies. There's no shortage of equipment or ventilators or masks or gloves or anything like that. So we have enough, and we have what it takes to take care of our patients in the hospital, in the community, and in all of our outreach areas. I think the staff has demonstrated quite nicely how well they can work together. We are not seeing staff calling in and saying, I have a cold, I have a sneeze, I can't come in. They are all showing up. They are coming in. They're doing more and above than what they're asked to do. They're staying, they're working together as teams. They're collaborating with each other and talking with each other. And there are multiple reports multiple times during the day between administrators, staffing, intensive care, etc., as to say, what's the status, what's coming in, what can we discharge? And in fact, the hospital opened an extra floor just to take care of the patients that they needed to.
I heard about this.
So I think that the hospital is incredibly well positioned, and from the top down and the bottom up, staff and faculty are working together.
And also, as I understand it, we are trying to ramp up testing methodology so we can quickly assess who's who in terms of symptoms and
and I
infection.
think not only over the next few days will we have actually a plan in place and ability to send out tests and get them back within 24 hours, which is much faster than the state. In the next 2 to 3 weeks, we will move that ability into the institution and have a less than 1 day turnaround. So I think every day we're moving, every day we're changing. And yes, we were handicapped like every other institution in New York about the need to send those tests out. Once we bring it in-house, that need will go away.
I have a follow-up question there, but I want to just turn to Nancy for a second here to say comparatively, again, we look back at Spanish flu. In terms of response, there was no real response. I mean, how would you compare with what Sharon said?
What I see that was the same was the extraordinary bravery of healthcare professionals, the doctors and the nurses. But because they would often get sick themselves, I mean, it was exactly the situation that we're trying to avoid by social distancing and flattening the curve, is to keep our people from being overwhelmed. But you see the same kind of dedication, but it was so fast moving that it was really hard to move quickly enough. Again, testing and isolating the people who do have it is critical to containing any epidemic, and that's what we need to concentrate on.
So looking forward, Sharon, so we think of flu seasons, annual flu seasons, right? There's a seasonal shift every year, and the flu season ends, and we go through the summertime dealing with other issues, and then flu season comes back. Is there any sense of where this is headed?
So the first question is, do we think we're going to see a shift in the virus? Do we think that what we're circulating now, the COVID-19, will in fact change next year and be a COVID-20 or 21? And the answer is right now we don't see that. From the data from China, there's no change or mutation in the virus. So if you've seen it this year, you probably will make antibody response to it, probably will be protected, and shouldn't see this virus affecting you again next year. However, how long will all of us take till we all get it? It depends on who you are, where you are, and who you're hanging out with. And especially it depends on the kids being asymptomatic carriers. So we won't know the vast majority of children when they get it and how sick they are. And because we won't know, right now some are in school, some are not in school, that has the potential to bring the virus much longer time into our communities and for the parents to get it. So we have sort of a double-edged sword. We think we'll all get it. We think we'll make antibodies that protect you. We think the virus will not mutate. On the other hand, we're probably all going to get it.
And in terms of seasonality, does that make a difference or no?
So probably not. Probably not. The reason we see seasonality in flu has something to do with temperature, but it also has a lot to do with exposure. With this virus, because we have no prior antibodies to it, even a little bit of exposure in the warm months will still get you infected.
And what about vaccines? What do you see in the future in that regard?
So the answer is that's a $64,000 question, and I'd love to say yes, no, and maybe. Developing a vaccine is not easy. The first thing you need to do in order to develop a vaccine is to be able to say, this is the part of the virus that you made an antibody to and it protected you. So without those kind of surrogate markers, it's going to be hard to develop a vaccine. Many companies are trying, and they're basing it on hypotheses of which part of the virus it is that's causing the illness that you need an immune response to protect you. So I think over the next few months, to maybe more than months, we will see multiple vaccine candidates be trotted out. They will go through phase 1, look at safety and immunogenicity, and be a win or a loss. The most important question to remember is we don't want to cause harm. And in the past, like with the dengue vaccine, giving it to children who had never seen dengue, and then when they got their first event of dengue did worse, we don't want to fall into the same trap. So it's not just simple, stick the vaccine into people and call it a day, but rather, is this the right vaccine? Are we going to cause harm by having an overwhelming immune response when you actually see the virus?
So it could be some time, is what I'm hearing you telling us.
I think the answer is wait and see. I don't think it will be as quick as people are trying to say.
Right. And just to pursue this part of the conversation with you, what specific advice can you offer to our viewers and listeners about the conduct of their daily affairs, how they're interacting with both others and objects in their life?
I think the first, as I've said before, is don't panic. The second is look and think. Hand washing, washing the areas that you're working with, having that social distancing are all important. And at the end of the day, if you're sick or you have symptoms, don't just show up in the emergency room. Speak to a provider, make sure you're going to the right place, explain what you're feeling, and then, if needed, get testing. And more importantly, if you test positive, isolating yourself and making sure your close contacts are also in isolation. That's how we're going to stop the spread.
Stop the spread of the disease. Stacey, looking forward, let's bring you in about the economy. What would be your predictions? 3 months, 6 months, 9 months from now, as best you can see at the moment.
I wish I had a crystal
I know I'm putting
ball.
you on the spot, but hey, I get to do that.
Yes. Well, I think that we have no need to be fearful. We have every reason to be prepared. And I think Susan has given great logic as to, the aims of practicing social distancing and, engaging in quarantine or self-isolation when needed. My hope is that, the government will enact policies that help out the most vulnerable financially, among us, and that we can find a way to come together to fight this, the spread of the virus together. So I'm optimistic. I'm hopeful. I think that the markets will rebound. I have no reason to expect that the markets won't. Yes, production will be halted for a time. Yes, people will be stuck at home and they probably won't be buying as much. And so I think, sort of in the short run of the next couple of months, we might see these dips persist. But at some point, people will be resuming life as normal. And, all of that pullback on spending will hopefully increase as people feel comfortable and confident, return to work with hopefully more supportive policies in place. For people who are living paycheck to paycheck or for people who are struggling to find childcare right now.
Do you see both the need for, the eventuality of even greater government intervention with respect to re-stimulating the economy, or is that an open issue as far as you're concerned?
Well, my general fear is that interest rates have been kept low for such a long time that in terms of, any sort of policy that the Federal Reserve could enact, there's very little room. But I do see promise in legislative measures that are designed to, provide businesses with incentives to offer paid sick leave, to, offer increased aid for parents who are looking for childcare, to ensure that workers are still paid even if they're unable to, make it to, for example, restaurants. I just saw, interestingly, in the news that Uber had vowed to pay any Uber driver who has been exposed or tested positive for coronavirus for the weeks that they're required to be in isolation. And I do think that corporate social responsibility in a time like this, companies that enact policies like Uber, I think will be embraced, by the public for their efforts to do the right thing.
Just looking a little more specifically economically, Stacey, so what about longer-term impacts, for example, on the retail sector or the travel sector, for example, even independent of a recovery, if you will, and even when, I won't say if, I'll say when, the virus is better understood and vaccine methodology has caught up, do you see potentially permanent changes in the way these sectors operate, given this impact right now?
I mean, yes, potentially. So, much of the world's material goods and retail goods are produced in China. And as we know, the Wuhan region, which is a center of production, I think it produces something like 10% of the world's goods, has been in isolation for the last, month or so. And so the production levels from there have been virtually non-existent. So I think we'll see for a while that the goods that were produced before production stopped entirely in the region will, maybe stay on shelves a little bit longer. But I think it's an interesting question. I think many companies will have to find ways to produce things domestically, which would, of course, help lower an an already low unemployment rate, a shockingly low unemployment rate. So I think we will see shifts in production, and some of that could be for the better, as potentially jobs return to the country that might have been located offshore.
I mean, very interesting points you made. I'm also wondering, we go through the next weeks, months of more and more businesses, organizations, and institutions doing business, online. By telecommunication and online. Then even as this episode recedes, hopefully sooner rather than later, maybe these organizations say, "Well, we're not traveling anymore. We can do this without traveling." Yep. So I wonder if that's a long-term effect.
I think we'll see potentially incredible transformative shift in the way that we
do business,
do work. Right. And, I think many people would welcome that shift if it means that they can avoid long commutes and spend more time with their loved ones. I'm really curious to see how this unfolds, and I wish that I had a crystal ball, but I'm, as you say, I am willing to bet that at least some of the travel that people used to have to do for work will probably not be seen as so essential after this experience.
Sharon, you wanted to chime in
So
there?
it's interesting is one of the things that we've talked about in the past was the idea of telemedicine. Mm-hmm. How easy is it? Should we do it, not do it? And generally speaking, people have sort of frowned on it. Mm-hmm. That idea of a doctor-patient relationship meant you actually had to see and touch each other. With the advent of people in isolation now, but still needing medical care, although not needing to come into the hospital, we are all exploring how best to use telemedicine. And I think over the next few years, we will see a shift of that traditional come to the office for your routine checkup to actually some of that being done via telemedicine.
It's so interesting you say that, Sharon, because just this morning I was in communication with leadership at Stony Brook Medicine about our efforts to ramp up telemedicine capacity to deal with this, to deal with these incidents, and to make sure that we're staffed up to answer questions, evaluate people, see if they need to come in for care or not. And telemedicine is the solution to that.
Right. In the past, people were very worried about patient confidentiality. Can you do stuff over the telephone, the computer, etc.? Now we're seeing a shift to, of course we should do it. Let's figure out how best to do it.
Right. So let me turn to Nancy. We, meaning those of us on the faculty and the general campus, we're living through this in a massive way right now as we work to go to non-traditional and remote forms of instruction to allow our students the option to go home, for example, and also to achieve the social distancing that as we've discussed, is so important to responding to this pandemic. So what are your thoughts about implications for higher education?
I think I've heard you say this, nothing is ever going to be the same again after this on many different levels. At the same time, I'm also beginning to hear some not pushback exactly, but people saying, I am at home working and I miss the office. So I think where we may get is to a healthier balance of where it's appropriate to do the telemedicine, but where you really do need to touch someone, that maybe will rebalance so that we concentrate our resources where they're best used. And that's my hope for the future. In terms of long-term gains, I'm also hoping that we learn a lesson from this about the need for emergency preparedness in public health, that a lot of progress had been made in that kind of planning that unfortunately seems to have not been firmly embedded enough to be acted upon. And I'm hoping this experience is going to get that back on them.
Well, that's a really interesting point, Nancy, and you bring an important perspective to that very question, looking again at the Spanish flu episode. So what are some of the historical impacts of that episode in public policy, in public health planning in the United States and so forth?
One reason we've studied it so much is because around the time of SARS and even with 9/11, there was suddenly, I think, a greater awareness across a wide range of government agencies, the CDC, even the Department of Defense, that pandemics can threaten national security, and we need to think, or economic security, as we're also seeing, that you need to think ahead. You need to plan ahead. And there's been enormous, one reason I got to study the Spanish flu was out of an interest in trying to learn through a look back into what we should be doing to plan ahead. I'm hoping we learn some lessons from this that mean the next time this is just going to keep happening, folks. This is not the last one. That we learn how to respond more efficiently.
Really interesting points, Nancy. And I reflect on, my own experience. I served at Tulane University in the wake of the Hurricane Katrina incident. Obviously, there were a lot of harsh lessons that came from the Katrina experience. As I like to say, there are no HVAC systems in the basements of any buildings in New Orleans anymore. And the same thing happened with Sandy here in New York. Those lessons were similar in New York. One of the interesting questions, and you've alluded to it right now, Nancy, is that we learn these lessons, we ramp up in response to them, and then somehow it starts to fade away over time, and we sort of forget the lessons. Yep. And then we're not as well prepared as we think we should have been when a new incident comes, as we're now experiencing. It is my sense that certainly in the wake of this pandemic, the call for greater investment in public health preparedness and response will presumably increase. What the result of that call will be is a different question.
So one of the things that lessons learned, as you've mentioned, after the SARS outbreak or the SARS epidemic, Peter Hotez, who was in GW and now is in Texas, was actually working on a SARS vaccine. And in their infinite wisdom, the funders of that stopped and said, we're finished with that SARS epidemic. We don't need to spend money on a vaccine. And he shopped around and shopped around and shopped around, trying to get anyone to help fund further development of that vaccine, and got no takers. And now all of a sudden everyone's like going, well, why did you stop? And he was like, why did I stop? Nobody would fund me.
Yeah.
So that's very interesting. Going back to the education piece, as Nancy and I were just discussing, the faculty and the staff at the university have come together in a remarkable way and are working very, very hard to transform the ways we educate and the ways we teach. Right. Not under the best of circumstances necessarily. Nobody wanted this to happen, but nonetheless, you alluded to this about the hospital, Sharon, about all the teams coming together to deal with this extraordinary challenge. And I think on the education side, that's exactly what's been going on in all our colleges and schools. Attitudes toward distance learning and online delivery of classes, it's a mixed bag. Some people are very supportive, some people are very dubious, a lot of people in the middle. There are a lot of things we don't know. At the moment, we don't have the luxury to sort of debate these things in the abstract. We're trying to learn by doing. And on the one side, I have to say the faculty and staff have been remarkable in sort of calming the chatter to just focus on the practicalities, but also at the same time, there's a lot of concern and anxiety out there about where we're headed, what's going to happen, and how will this roll out. I think things will not be perfect. This is going to be messy, at least, in getting our courses ramped up, for the balance of this semester.
But what we are seeing is a lot of creative thinking. Mm-hmm. In the past, someone who would have creative thinking about telemedicine or distance learning, we'd say, we don't need that. But now all of a sudden, we're seeing creative thinking from all parts of the environment. Everybody's having creative suggestions about how to handle flow of patients, how to handle triage, how to handle who's coming on shift, who's coming off shift. Those creative thinkers in the past might not have been so vocal about their ideas, and now we're seeing a lot of interesting ideas from people all over.
Well, necessity is the parent of invention. We know this all the time, and so let me. We have a little time left. I want to shift the focus to the three of you. I just want to ask, sort of personally, how is this changing your own routines? Your days, both from the objective sense of work, but also, obviously you have households, you manage. Stacey, we're going to start with you because you've gone through the biggest change of all.
Yes.
But as I say, just for the sake of viewers and listeners, just from a personal perspective, all of us are living through this in real time, and how is it affecting you personally?
Yes, so for listeners who joined after the introduction, I do live in New Rochelle, which is a hotspot of activity, and life here has changed quite significantly. I remain hopeful and optimistic. I have no reason to believe that I or any of my loved ones have yet been exposed other than the fact that I happen to live in a certain zip code. But, we're remaining cheerful, trying to engage in healthy practices, to eat good foods, eat healthy foods, to rest as much as we can, to reduce stress, and, to remain patient and calm in the face of any new information that we get. Thankfully I have a background in, with research and statistics, so I'm able to decipher all of the information that I get, and hearing from professionals like Susan is immensely helpful, because I think she has a very optimistic and hopeful message as well. But, my goal is to flatten the curve. So we've been engaging in social distancing, trying to stay home as we are able and allowed. My daughter's school was actually called off today for an unspecified period of time. So things will be interesting over the next week as we figure out childcare and the like, so that we can all continue to work. But my colleagues in the College of Business have been wonderful. As we've been thinking through remote learning and online teaching, the discussions that I've seen unfold from all of my colleagues, from the least tech savvy of us to, very, very, high tech innovators, has been wonderful. I think we're having thoughtful questions about how we can provide continuity to our programming. And, we've attended each other's virtual classes. We've joined in on discussions with each other. And I know that students in the College of Business will continue to receive the best quality education that our talented faculty have to offer.
And Stacey, let me ask, since you're talking about the work with your colleagues, I'm just curious, and both Sharon and Nancy may have things to add. What are you hearing from your students, if anything? Have they engaged with you both individually and collectively about this?
Yeah, so we attempted a virtual meeting on Wednesday so that I could get my students used to using Zoom, which is an online meeting platform. And yes, and I had my chat window open. We had audio video privileges for everyone, and we had. One of my students said this is the best experience they've ever had. They entered the class sort of with trepidation, wondering how things would function online. But, it felt like we were having a discussion, among people who are happy to be getting together, and figuring out a way to continue the discussions that we'd had in the classroom virtually. And I think we achieved that.
Nancy, maybe I can pitch to you.
I had such an unexpected experience. So I had my last face-to-face meeting with my class. It's about 18 students, of whom 8 showed up. And what amazed me was their willingness to talk and to help as a collective. So I posed to them, what do you think we ought to do here? And they had terrific ideas. I also heard from them a rather plaintive, when they found out that I was still going to be coming to campus and that I was going to sit in my classroom and do the Zoom. When we came back, they said, we want to come sit with you. And they all said they knew the under 12, they'd heard that.
Right.
And they
Numbers.
all did this.
Yeah.
One of them said, whoops, and moved, so he was a little further away. One student said, I'm taking 6 classes, 5 of them online, if I could have one where I could still, and it's their relationship with each other. I mean, I think they also like me and I like them, but it's the connection with the other students.
Sure.
We're going to make it work.
So, you've touched on this a bit, but let me pursue it. What about your daily routine? How is this affecting you directly?
I'm very interested in mental health, and I think that the mental health piece of this is a real challenge. That there was a lot of anxiety about other stuff going on out there in the world, and now I feel like I need to cultivate my Zen, but also to project that calm kindness. Be gentle, be kind. Don't use this as an opportunity to criticize and be spiteful. And I spent a lot of time thinking about health information and being a smart health consumer. This is a great opportunity to really cultivate good information and don't listen to some of the crazy stuff.
We're just about out of time, but Sharon, for you?
So my days
daily?
have been busy, and very busy.
Yeah, I bet.
And I've been doing a lot of extra webinar speaking to schools and people around the country. The Pediatric Infectious Society has sponsored webinars across the country to give ideas and plans, how are you going to see the well patient? Don't bring them into clinic. How are you going to get the telemedicine? Where are you going to send the labs? Real sort of concrete steps to help each other. From the Department of Pediatrics perspective, we've really had a lot of meetings together, some virtual, some in person, about how are we going to triage our patients, who's sick, who's well, and as well as the complicated patients, where do you send those? Are they our patients? Should we go to the emergency room, et cetera? So I think having, an EMR is definitely helpful, but I think also bouncing ideas off of each other about what is the best way to triage, who to triage, where to triage, and what to do after hours. Having all of us talk together has really made a difference. And our department chair, I think, is working about, 25 hours a day now. Yeah. And Dr. Milan, is doing a great job, and she is communicating with us faculty pretty much on a daily basis, asking our opinions and listening to what we suggest.
Right. So I want to say one thing, and then I have an announcement to make by way of concluding our podcast. I would say that as our 3 colleagues here on this podcast have demonstrated all across our university, the faculty, the staff, and the students have pulled together to work through this unprecedented challenge in an extraordinary way. I think Stony Brook is leading the way, and I can tell you, I'm on daily calls with SUNY system authorities and with other colleagues, and often the questions are, what are you doing at Stony Brook? What are you doing at Stony Brook? Because they know we're making great progress here. So I can't say enough positive things. An announcement, and I will, this is literally breaking news, is that we're scheduled to go on spring break as of this coming Monday. Normally that would be a 1-week break. We are extending spring break to 2 weeks. So that instruction, which normally would have commenced on Monday, March 23rd, will now commence on Monday, March 30th for the affected colleges and schools. So just to emphasize, spring break is a 2-week hiatus now, not a 1-week hiatus. This will give us a chance to sort of capture our breath and make sure that we're able to go to the non-traditional instruction and remote instruction in the most effective ways possible. And we will continue to learn more about this unprecedented pandemic. So Dr. Stacey Finkelstein, Dr. Sharon Nachman, Dr. Nancy Toms, can't thank you all enough for being with us for this time today and enabling all of our community to learn a bit more about the COVID-19 crisis. Thank you all. Thank you for being part of
Thank you for having us.
podcast.